Hey, do you know that oral assessment, or oral care plan in doing OSCE for adult nurses is one of the easiest, right? Okay, so today we are going to talk about oral assessments. Okay, for adult nurses doing OSCE. So oral assessment is one of the written or silent station. It's an 8-minute station. Okay, where you'll be given a scenario, okay, about a patient. Okay, so there's 4 distinguished phases. Okay, all right. So we have the critical care scenario, the cancer scenario, physical and learning disability scenario, and end of life scenario. So basically, you can either be given a scenario which contains or talk about a particular patient, his condition, his state. Okay, then they'll give you something like about 4 or 5 scenario that stand out by itself, describing the state of the patient's mouth, okay, or the oral condition of the patient's mouth. And so you're supposed to formulate a care plan for this particular patient. All right, so today we are going to focus more on the critical care scenario. We'll do the others later. Okay, all right, so stay tuned and enjoy it. All right, so for the critical care scenario, basically they're either going to give you a scenario talking about the state of a patient's mouth, or they are going to give you a picture of a patient in a critical care state, and it will tell you to formulate a care plan, an oral care plan for this patient. So I have a scenario here I want us to use to answer a question, the critical care scenario question. All right. Okay, so CJ was admitted to the ICU last night following a road traffic accident and is currently intubated. You have noticed the following. So this is the scenario I was telling you about. 1. CJ is currently at risk of ventilator-associated pneumonia. 2. Seri has bad odor from the mouth. 3. Seri mouth is very dry. 4. Seri shows signs of traumatic ulceration development. Then 5. Seri occasionally has secretion in the back of his mouth. So this is a state of the patient's mind. You've been asked to formulate please create an oral care plan for Seri. And to be able to pass this stage, you need to be able to critically identify which kind of scenario is, or which kind of state or condition is this patient in. The patient is the patient in a critical care state? If the patient does the patient have cancer? Does the patient have physical or learning disabilities? And then does the patient or in the state of end of life? So you need to be able to identify which kind of scenario you are going to use to be able to formulate your care plan. All right, so I have this acronym. You know me and acronyms. All right, that's probably helped me doing mine. So I'm going to list them on the screen. All right. So we have TTAMSR. TTAMSR. So someone who is critically ill and has this probably condition, the state of her mouth, said CJ. You can see the state of the mouth is really not in a good shape. And so what are you going to do as a nurse? Okay, so for the T, the first T is twice daily teeth cleaning with soft, compact headed toothbrush or suction toothbrush. Then the second T, okay, it is twice daily chlorhexidine mouthwash. Okay, chlorhexidine mouthwash. This is to prevent ventilated associated pneumonia. Then the A is to apply oral moisturizer to the oral mucosa, and also apply lip balm every 2 to 4 hours. All right. Then we go to the M. Okay, the M is to minimize traumatic ulceration by the endotracheal tube. So how can you do that? All right, by using fasteners or vice block, and also alternating the tubes. This can help prevent ulceration by the ET or the endotracheal tubes. Then the S is suction. You remember as part of the scenario they talked about the patient have a lot of secretions at the back of the mouth, so probably suction will help prevent aspiration. All right. Okay, and then the last one I'm going to talk about, that which is the R, is the need to identify the need for regular reassessment every 8 hours. Okay, right. So the acronym is TTAMSR. All right. So this is probably what the oral care plan for critical care is. For the end of life, the physical and learning disability, and the cancer, we'll talk about it in a different video. Okay, so this is probably what the oral care plan is about. Thank you very much. Bye.